Good morning. Yes, these are the first data sets we've had for the winter SIREPs. It gives you an overview of what's happening in NHS England with the number of patients who are in hospital beds with winter viruses, flu, COVID, RSV, pneumonia, among other winter illnesses. And it's what we were expecting, really. It's quite a grim view at the moment. The number of flu patients in hospital beds across England has already exceeded 2,000 for a single day compared to the same week in previous years. Now, this could be an indication of an early flu season, but one that will peak early. That's a best case scenario. We get an early peak and then it tails off into the middle of winter, or, and this is the worst case scenario, it could be a signal of a worse than usual flu season to come. The indications were how we normally prepare for the winter flu season is we look at what's happening in the Southern Hemisphere. We look at Australia, for example, and see what's happening there with flu. They had a really damaging flu season. There was a new strain of the flu virus, which you expect with viruses. They mutate and change, and that's to be expected. But this was a particularly strong strain, and it really did affect Australians quite badly. Lots of hospitalizations and quite a few deaths from the flu in the Southern Hemisphere. And it seems to be that we are following in the same pattern. That's what normally happens. We have the Southern Hemisphere, and then when it's winter over here, our flu season tends to mirror what's happened there. Now, what's interesting context for all of this, Darren, is the 2,040 flu patients in hospital beds across England on the 30th of November is a 74% rise from the same period last year. So that does tell you that we are expecting a very bad flu season, much worse than it was last year. Last year, you have to remember too, wasn't low either. It was the most since 2021. So we had a really bad flu season last year, the strongest since 2021. And this year, the earliest indications, the first set of data suggests that this is going to be an even worse flu season ahead for the NHS. I was in hospital this week speaking to consultants who deal with RSV and pneumonia and flu, and they were saying that they'd already seen it. So anecdotally, we had this evidence gathered. And this is the data set that supports that anecdotal evidence. And I met one of the patients in there, Paul Mather, who has pneumonia and pleurisy, and he was in a pretty bad way. He is recovering, I'm glad to say. But listen to what Paul Mather had to tell me about his condition.
I thought the end was near, I'll be honest. But
you thought you were going to die?
I really did, yeah, seriously.
Couldn't breathe?
Oh, well, the thing is, every time you breathe, that's the sharp pain. And so you've got to breathe, obviously, and that was just giving me so much pain. And finally they realised it, got me on morphine quick. And they've been very good. They've been very good.
And clearly, Paul is in some discomfort there, struggling to breathe. And just during that filming, he had to be moved by some of the nurses. And it was clearly very, very painful for Paul. Now, Paul is just one of those patients in that respiratory ward. And I walked up and down that ward, and every single bed was filled with a patient who was suffering from a respiratory winter illness. And that's just one hospital in one part of the country. And we've had reports coming in all over the past few weeks just how much pressure there is on hospitals. And remember, flu in one part of the hospital, big pressure, the bed's taken up, and that pressure then goes right throughout the hospital system. A&E has to try and find space for patients who come in through their doors. A&E is extremely busy. We saw patients in corridors, which is the one thing hospitals and trusts and the NHS really are keen to avoid. But when you have the numbers of patients coming through those doors that need to be triaged and then treated, the pressure just keeps building. And of course, we've got the doctor strikes further ahead this December. So that's going to pile even more pressure on NHS England, patients and hospitals throughout the country.
Yeah, and those figures that you just talked about are quite extraordinary. I think, as you say, and you can see that at the bottom of the screen, up 56% compared to this time last year. But it's also higher than at any point since 2023. It's higher than it was in 2022 as well. And there are real concerns now, aren't there? You know, I'm reading here about effectively medical professionals saying, you know, they are concerned that thousands of people may well die this winter. What in relation, though, to the actual flu jabs themselves, have we any sense of what take-up's been? And I suppose the advice still is that it's not too late to get yours.
Yeah, absolutely right, Darren. That is the key to all of this. We're looking at these figures and you're thinking, why do flu cases keep rising? Why does flu affect more people? Why are more people hospitalized? Flu vaccination intake has been declining steadily. And that's why every winter you get these health alerts from NHS England urging people over a certain age, or if you have comorbidities, if you have an underlying health condition, to go and get vaccinated. Unfortunately, vaccination rates are declining, not just among the wider population, but also among NHS staff. It's at around 40%, and with the wider population, it's around 50%. So clearly that's a concern, and that's something the government will have to try and address through public health messaging. Flu vaccinations work, and the more people who are vaccinated, the less the virus spreads. That's how vaccinations and viruses work. But clearly, there is skepticism within the wider community and among NHS staff, which is really worrying, because not only do they become ill, they can't go to work, and if they can't go to work, then that puts even more pressure on a workforce which is struggling to cope with demand. So yes, vaccinations are the key, and the government messaging will be around that again. If you are eligible for a flu vaccine, there was a problem last year with the supplies of the vaccine, and hopefully that won't be the same this year. But clearly, from the figures you've just been reading out and the ones we've been going through, it looks like it's going to be a particularly challenging flu season ahead.